Сейчас мне надо, потому что мне надо маленькая технологическая помощь. Сейчас...
Два слова профессору Заике, проректору по международным отношениям. Прошу.
Спасибо большое.
А вы подключайтесь.
Dear teacher, dear student, today I did like to greet Dr. Ravan Jayadungi, a PhD doctor from Canada. He studied in many years ago, but maybe not many years ago. Few years ago, he studied at our university and graduate 1993. I think that our university helped him to make a good start in the doctor future. And I think that Dr. Ravan talked us about short history about your level at the life, and after them read the lecture for student and teacher alma mater, post-traumatic distress disorder. I know that he many year work with this medical and psychological problem, and today we can listen this lecture. Thank you. Welcome to Alma Mater.
Thank you very much. Спасибо вам большое. Спасибо. Вам видно вот my presentation?
Нет, пока не видно.
Нет, да? А что we turn to caption present now?
Справа внизу Start Show. Open your presentation, please.
Да. Я открывал это.
Так.
Да. Share.
Click your presentation.
Turn on captions. Да, дайте мне 5 минут, я отношусь вот это чат. А сейчас как?
Начинается старт-шоу.
Вам сейчас видно?
Yes. Large size, please.
Хорошо. А сейчас?
Yes.
Вам видно, да?
Very good. Yes.
Хорошо. Спасибо вам большое. Okay, so I would like to thank my beloved university that gave me education. And I would like to present a post-traumatic stress disorder presentation. Recently, I watched a YouTube video on Vinnytsia Medical University. Actually, it was very nice and a lot of successes. And the students are having a lot of facilities now. Not during our time, we didn't have internet, we didn't have YouTube, we didn't have Skype or any other facilities. But nowadays, students are very lucky. So I think our university will prosper, and the students who studied at the Vinnytsia Medical University, now they are working in different countries. Practically every country, they are working and doing a good work. So before starting my lecture, I would like to tell a few things about myself. Это когда я we used to pay this city so possibilities was more good. And yeah, pathologicheske anatomia cathedra. You can see me atish atkrita halatum isigda pripadavatili minya prithilya wearing a George Michael t-shirt. And I lived in the hostel number 4, Simso Dwatsa Chitiri. And these were my batchmates. They are from Sudan, India, Sierra Leone. We had most of every countries except South Africa at that time. This is 1993, our graduation. And me, 1993, young doctor, not old like today. And after finishing my medical degree in 1993, I went to Sri Lanka, and for 16 years I worked. Predominantly I worked in the psychiatry field. And also I had the opportunity to work for the Sri Lanka Army. So I was a major in the Sri Lanka Army, and used to treat a lot of patients with post-traumatic stress due to the combat trauma. And I had the opportunity of going to different countries and speak to different specialists in this PTSD field. And I shared my knowledge, my experience with them. In 2006, I was invited by the Colmary O'Neill Veteran Administration in Kansas to give a presentation on PTSD. And also, after coming to Canada, I went to York University and I studied psychology. Also, I studied at the University of Toronto. So this is my life in Canada, and now I'm a clinical psychotherapist, not a psychiatrist. And because I like the field psychotherapy, because during our time we had a great professor named Professor Serkova. She was a brilliant professor who taught us psychiatry, and she inspired me. So yeah, очень благодарен для профессора Серковой, потому что она нам читала психиатрию. Сейчас мы смотрим, что такое PTSD, пост-травматик стрессовая болезнь. Это psychological cluster of psychological symptoms, and that can follow a psychologically distressing event. The typical symptoms of PTSD occur after recognizable stress or traumatic event that involved in intense fear and horror. PTSD denotes an intense, prolonged, and sometimes delayed reaction to an extremely stressful event. In Russian, I did the Google translation, so I hope we get the same, at least near the representation. The post-травматические расстройства. So this is the definition of PTSD. So you can see it can come out after traumatic situation. So these are the events that can cause PTSD: military combat, soldiers in the war front, violent personal assaults, sexual assault, robbery, etc., kidnapping, terrorist attack, torture, incarceration, prisoner of war, natural disasters, automobile accidents, and being diagnosed with any acute illnesses. We know that this is the corona period, and I have seen a number of people with PTSD because of that fear, the coronavirus condition, the fear of death. So these are the symptoms of PTSD, symptomy post-traumatic расстройства. There are a wider range of psychological symptoms. We say hyperarousal symptoms, re-experiencing symptoms such as intrusive memories and flashbacks, and they have nightmares, kashmari, and symptoms of avoidance, symptoms of emotional numbing and restricted emotions. Вам видно, да, вот эти симптомы?
Yes.
Хорошо, хорошо. Если вам надо вот время, скажите мне. So there are other common symptoms of PTSD, especially hostility, guilt, shame, and we know substance abuse, alcoholism, reduced motivation, negative self-image, depression and hopelessness, reduced life interest, suicidal thoughts, feeling alienated, problems with intimacy, feelings of mistrust and betrayal, cynicism, frustration, revenge fantasies, and resignation. So I have translated these symptoms into Russian. So вы можете читать вот эти симптомы.
Yes. Yes.
Okay, so comorbid conditions of PTSD, alcohol and substance abuse, panic disorder, agoraphobia, generalized anxiety disorder, obsessive compulsive disorder, social phobia, bipolar disorder, they can go hand in hand with PTSD. Sometimes I have seen PTSD with schizophrenia.
Thank you. Yes.
Also, PTSD with psychotic symptoms are not rare. According to the researcher Kessler, он говорит, что 16% of PTSD public может иметь психологические симптомы. I remember one time when I was working in Sri Lanka, one очень знаменательный профессор психиатрии, он меня отправил один больной, diagnosed with schizophrenia. And he was a soldier, he could hear helicopter sounds, the звуки вертолета. And when I spoke to this patient, I realized it was not an auditory hallucination, it was a flashback, PTSD flashback. The professor thought it was an auditory hallucination, and sometimes he used to get PTSD flashbacks, and he could see some of the battle events. So he was diagnosed with schizophrenia. So later I did the reassessment and found that this patient was not having schizophrenia, but PTSD. So those students who want to follow psychiatry, please remember 16% of PTSD patients can have psychotic symptoms. Those we are called transient psychotic symptoms. Actually, PTSD is a relatively newly defined disorder with an old history. PTSD was there. Some people think that PTSD is an American illness. It's это американская болезнь. Это неправда. Потому что во время in the ancient Egypt, the doctors used to write about PTSD kind of reactions. Even the Holy Bible talks about PTSD type of characters, Job and his trauma, and the epic the great epic of India, the Mahabharata, talks about the combatants with battle-related reactions, and Homer, especially Iliad, talks about PTSD type of reactions. Remember Achilles. Achilles, he had a survivor's guilt after the death of his best friend Patroclus, and Achilles, he had outbursts of anger, and he was emotionally unstable, hostility. Even though he was a great warrior, Achilles, he had vivid symptoms of PTSD. And Shakespeare wrote about PTSD. Если вы помните Lady Macbeth, у нее была кошмары, nightmares, sleepwalking, and compulsive hand washing. And Cervantes, he's a Spanish author who wrote about Don Quixote in 1605. Cervantes, he was a prisoner of war, and he participated in a number of battles, and he came to Spain after long years of war as a tired soldier, and he had hallucinations. And he created this funny character, Don Quixote. And Don Quixote was having certain type of hallucinations, flashbacks. This is what was going in Cervantes' inner mind. And Ivan the Terrible, Ivan Grozny, Zapomnite, he had anger outburst, deep suspicion, revenge fantasies, impulsivity, cruelty, and accidentally he hammered his son and he killed his own son. So I think Ivan the Terrible, Ivan Grozny, had a number of PTSD related symptoms, потому что у него было очень нехорошее детство, тоже нарушили психологическое состояние, and there was cruelty to animals. And Ivan Grozny had a lot of PTSD related symptoms. So Samuel Pepys, in the Western history, the Samuel Pepys describes the Great Fire of London in 1966, and a lot of people had PTSD related symptoms. And the PTSD victims of Russo-Turkish War. Professor Buganov очень хорошо написано вот эти post-traumatic reactions among the soldiers during that time. So, and some soldiers had psychogenic aphonia, loss of their voice in the height of the war. In 1800s, these condition was called railway hysteria or railway spine, because that time there were a lot of railway accidents. After these avari, people call it railway hysteria. And Dr. Mendes da Costa, he's a American Civil War a physician. Yeah, he found 300 soldiers. They had cardiac symptoms. He called it irritable heart, but he didn't know these were psychological manifestation, because at that time there was no word called psychological, and he thought they had some irritable cardiac symptoms without any organic pathology. It's Sigmund Freud. On очень умный человек, очень глубоко читал, он знал некоторых языков, и он очень точно написал о PTSD. Он не использовал слова PTSD, он говорил traumatic neurosis. Если вы читаете вот у Фройда the case studies, you will find a lot of PTSD type of case studies. Especially today, we have rape trauma syndrome. I remember, if I'm not mistaken, Freud has one case study, Fräulein Catherine. So she was sexually assaulted by a person. After that, she had PTSD type of reaction. And Freud очень глубоко написал об этом. So I believe that Sigmund Freud knew PTSD, and also he knew this rape trauma syndrome. Это наш любимый Leo Tolstoy. Maternal and paternal deprivation. Both parents died when he was small, and he was exposed to war in Sevastopol, and he had chronic depression throughout. And one time, soon after the war, he had an anxiety attack that had because he thinks that it changed his personality. I think Leo Tolstoy had a number of post-traumatic related symptoms, and later on he had problems with his wife. And his final days, he left his house, and he didn't want to see his wife. So relationship problems and these chronic depression, those were connected with PTSD. So during the World War I, they called it shell shock because the doctors thought these shell explosion causes miniature hemorrhages in the brain. So that's causing shell shock, but it was not 100% true. And these soldiers had medically unexplainable symptoms: paralysis, amnesia, temporary blindness, deafness. But at that time, the generals, military authority thought that these people were malingerers. They were faking. They were showing these symptoms to avoid war. The British Army executed. They killed more than 300 soldiers with shell shock, accusing them as malingerers. And after so many years, the British government they asked for the pardon. Some soldiers, there were a lot of French suicides during the World War I. So at the end of the World War I, the British Army diagnosed more than 60,000 shell-shocked men. Even the French army had, even the Russian army, Imperialistiskие Русская армия, they had shell-shocked soldiers. And Professor Bekhtereev, Ivan Pavlov, Anis Nali shell-shock, they wrote about shell-shock because recently I met Professor Vladimir Bekhtereev's relation, Professor Vladimir Lerner. He lives in Israel, and he told me that Professor Bekhtereev, he knew about shell shock, and also he wrote about Joseph Stalin that caused a lot of disturbances, and later this Professor Vladimir Lerner, Bekhtereev's relative, believes that he was отравили by Stalin. During the World War II, they used combat fatigue to describe people with combat stress. They were not sympathetic to the soldiers. And Hitler had a lot of symptoms. He had a traumatic childhood, жесткие отец действия, and 2 times he was exposed to shell blasts, and 1 time the entire platoon was killed, and only Hitler was able to save his life, and he was exposed to a gas attack during the war, and he had amphetamine addiction given by his private doctor, Dr. Moral. And in the final days, you know that Hitler was very delusional. He was asking his general to move this army, that army, that were not existing. So he had definitely Hitler had PTSD related reactions. And the other factor is his lack of empathy, emotional numbing. He pomnit Strafnoi battalion. During the World War II, those soldiers who had contusia, psychological reaction, they were considered as cowards, and some of them were shot in the battlefield, and some of them were sent to Strafnoi battalions, and they had to skupit his Skrovia. And we believe that a large number of these soldiers had PTSD type of reactions, and they were not cowards, but people with acute PTSD. So during the Vietnam War, a lot of research were done. So more than 8.5 million individuals served in the US Armed Forces during the Vietnam War. So they've found more than 50,000 Vietnam veterans with full-blown symptoms of PTSD, but this Shifra is more than 50,000 now, because there are late reactions of PTSD. After 30, 40 years, people are getting PTSD type of reactions. And some of the veterans of the World War II, they are getting PTSD type of reactions after 30 years, 40 years. In my particular practice, I found one patient had late reaction of PTSD after 13 years. So in Philadelphia, I met some Vietnam veterans, and I was able to treat some of the soldiers. And even though they came in very early 70s, they were still having PTSD reactions. So it can be lifelong. And we cannot forget Soviet-Afghan War, because I had a friend when I was in the first year. My roommate was Victor. He returned from Afghanistan, and he had a lot of problems. And I remember I used to play these rock bands like AC/DC, Whitesnake, Deep Purple, Metallica, and he couldn't tolerate sound. And we used to have a lot of arguments. And he used to drink a lot. He had nightmares. So today I believe that Victor had post-traumatic reactions after exposing to the battle conditions in Afghanistan. So in 1980, DSM-3 used the word PTSD, post-traumatic stress disorder. So these are the conditional risk of PTSD. So we know be a POW, prisoner of war, it's 53%. I have treated a lot of POWs with PTSD, torture, facing a gunshot injury, witness killing. And there are many associated problems with PTSD: self-harm, suicide, violence, homicide, domestic violence, alcohol and substance abuse, cruelty to children, low productivity. I remember that during our time when we were studying in Vinitsa, a lot of people with stress used to say yazva, because these stress reactions came as ulcers, gastric ulcers. So PTSD patients have intrusive memories. So I would like to say a few words about the 30-year war in Sri Lanka. I served as a military doctor, especially in the psychological front, and it was a horrible war. And there were child soldiers, and later on I treated a number of child soldiers. And I worked with Professor Daya Somasundaram from the University of Adelaide in Australia, and we wrote chapter 23 in the Cambridge University Press in 2015 about the child soldiers. So this is one of my patients, his intrusive memories of a landmine explosion. So this was his intrusive memory every time he used to see this. And artillery attack. This patient was a POW, prisoner of war, and he was kept in chains in a dark room. And he describes his interrogation, the mock assassinations. A number of times he was taken and just pretended that they were going to kill him. So he had severe fear, and he witnessed how people were tortured, and also he saw how people were killed. So upon his release, he was the prisoner of war for 8 years. So upon his release, I treated him. He had full-blown symptoms of PTSD with psychogenic aphonia. This is another person. He was an interrogator. And he used to torture people, and he had this horrible nightmare with the bleeding skull, the bloodbath. He was drowning. So this is another vision of a soldier, the artillery attack. And this soldier had PTSD with survivor guilt. This is the mutilated body of his best friend. So intrusive memories, combat situations. Flashbacks of an attack. You see the dead people. And I treated one lieutenant. He witnessed death of his 8 soldiers. So due to artillery attack. So he was able to save his life, but he witnessed the death of his 8 soldiers, and he had full-blown symptoms of PTSD. One of my patients after a bomb blast told me this. And these patients, they did not know what was happening with them. So children and trauma are also important to understand, because children can have a PTSD. I have seen a large number of children with PTSD after facing different types of traumas. This is a child who lost his father. And it's psychologically, you can analyze this picture. His father is here, and the large fish is coming to attack the father. The large fish is death. Smert. The child is idealizing death as a large fish. So tsunami disaster in 2004 generated a lot of PTSD patients. And this is a flashback of another soldier, how he saw the giant wave. And we did a PTSD research study. We screened 824 combatants, and we found 56 combatants with full-blown symptoms of PTSD and 6 with partial PTSD. This is the first PTSD study in Sri Lanka, a combat-related PTSD study. So when we start talking about PTSD, some of the top senior military people didn't like. They thought PTSD was an American illness, and we are bringing this Vietnam disease to Sri Lanka. But later on, they realized that we were correct. So we'll talk about the management of PTSD leukemia. Usually, drug treatment. The doctors use a number of medicaments. Use antidepressants, SSRIs like fluoxetine, paroxetine, and mood stabilizers, and also vitamin therapy, especially vitamin B that reduces aggression, and patients with brain injury, they prescribe anti-epileptics. In psychological management, we use cognitive behavior therapy, also effective, and client-centered therapy, or we call it Rogerian therapy. This was introduced by Carl Rogers. During the Vietnam War, these doctors used a client-centered Rogerian therapy with empathetic listening to their stories, and existential therapy. Remember Viktor Frankl, Holocaust survivor. Meditation and yoga are extremely effective. And EMDR. It's a relatively naively defined psychological therapy discovered by Dr. Francine Shapiro. I was trained in EMDR in Philadelphia. So this is in 2002. We were trained by Dr. Nancy Erebo and Dr. Jonathan Brooks. And this is, I'm treating a combatant, and Dr. Nancy Erebo is observing me. In EMDR, we process the traumatic memory, stimulating left and right brain hemispheres. And also, this is one of my gurus, Dr. Susan Rogers in Philadelphia. And Dr. Steven Silver, Director PTSD Program in Coatesville Veteran Administration. And I had the privilege of doing a presentation in Kansas, in Calmary-O'Neill VA. This Dr. Mahasen De Silva, he's a board certified psychiatrist. He's treating Vietnam veterans. And in 2017, I had the privilege of meeting with Professor Judith Herman. She's the person who introduced CPTSD, complex PTSD, or DESNOS, disorder of extreme stress, not otherwise specified. Очень умная женщина. Professor Vasil van der Kolk, also PTSD researcher in Boston, and Professor McFadden. He does meditation and neuroscience at the University of Toronto. And this monk Yukta Dhamma from Hamilton, Canada, he's treating people with trauma with meditation, meditatsia. And psychosocial rehabilitation is important in PTSD, housing, employment, etc. And this is the book I wrote, Shell Shock to Palali Syndrome. Palali is an aerodrome in Sri Lanka, and because shell shock is during the World War I, and Palali Syndrome is in 1983, the Sri Lankan War. So how PTSD, the evolution of PTSD, and this book is available online on Amazon. And I wrote a book about my past experiences in the USSR, PTSD in the Soviet Union. And in this book, I tried to look at the Soviet history and the World War II, Отечественная война, и Golodomor, a lot of traumatic events in the Soviet history, and how it generated PTSD. Even after Chernobyl, there were PTSD. And this is a German professor, Professor Michael Linden. He introduced the term post-traumatic embitterment disorder. It's a newly defined condition because he found a lot of post-traumatic reactions in after the unification of Germany. He found a lot of embitterment reactions among the East German people who joined the West. So then he came with this idea, post-traumatic embitterment disorder. So I am one of the representatives in Canada in this newly defined disorder. Very soon it's going to come to ICD-10 and DSM. And I wrote a research article with one psychiatrist, Dr. Rami from Lebanon, and Marina Stahl from the USA about Felix Dzerzhinsky, because Dzerzhinsky was a very interesting character. And during his childhood, he had a lot of trauma, the poverty, and he accidentally shot and killed his sister, and he was arrested. And later, he becomes an interrogator for Cheka. So we, in our article, we surmised that Felix Dzerzhinsky had post-traumatic embitterment disorder. So I think that's all I had to tell about PTSD. And if you have questions, you are most welcome.
Thank you, and please, questions.
I have some questions.
Okay, yeah.
First of all, I would like to thank Dr. Ruban for this prominent presentation. It was a very interesting historical discourse, and it was kind of interesting to listen how you try to find symptoms of PTSD in literature. So thank you for that. And I would like to tell that me and my colleagues from Department of Medical Psychology and Psychiatry currently work as CBT psychotherapists with veterans of Ukrainian war.
Wow.
Yes, for us, this presentation was very interesting in sense of opportunity to share experiences. So you've mentioned that you use CBT and EMDR for treatment. Would you be so kind to comment what is the most effective method from your experience? Maybe you could share some techniques that you use. And one more question that I have, because the drawings that you've showed, they drew a lot of attention. So I wanted to ask if you use art therapy, or maybe you use that drawings as part of treatment.
Thank you very much. Yes. First of all, I would like to know your name. Could you kindly tell us your name?
My name is Anna Kaminska, MD, PhD in medical psychology.
Okay, great. I'm really happy about your work and the work you do with these veterans. I know veterans in any country are having a lot of problems. It's so sad to hear that my beloved Ukraine is in war, because I always consider Ukraine as это моя вторая родина, потому что my юности, я жил 7 лет in Ukraine. So, and I have very, very beautiful memories of Ukrainian people. They are very hospitable people, and they are very beautiful people. And I'm so sad about this military conflict in Donbass. So yes, when talk about psychotherapy, EMDR is, I think it's more effective than CBT because I use CBT, but in EMDR, it processes the traumatic memories. Let me simply explain this. Let's think if you had a bad meal and then you get vomiting, stomach aches, nausea, because that food got stuck inside your stomach. It's not going away, and it's unprocessed food in your stomach. So traumatic memories are like this. When traumatic memories are not processed, it can there for long years. Among the Vietnam veterans I have treated, some people had encountered their initial trauma in 1960s. In 2006 also they have flashbacks and nightmares about this 1960 trauma. So it indicates that these memories were not processed. So EMDR, what we do, we stimulate left and right brain hemispheres through eye movements or bilateral tappings like this. And it helps to process. And EMDR has a cognitive portion, psychoanalytic portion, and desensitization portion. And it's very effective. And even I'm using online EMDR with due to Corona situation. Now I see a lot of patients online, and some of them I treat. And also writing. I encourage my patient to write their traumatic experiences. Why writing is important? Because when you use therapeutic method like Rogerian therapy, talk therapy, obviously they try to censor what they say. Sometimes they don't want to talk about their traumatic events, and they try to sort of repress some of the traumatic memories. But when they start writing, they recall all these vispaminane, and there are no censoring, and a lot of channels are opening. So I ask them to write their trauma. Some people are good, some people are not good in writing, but those who are really good narrating their trauma, some people write 5-6 pages about the traumatic event. After that, I do EMDR, then that trauma is processed. So I find EMDR is more effective than CBT, but in some cases CBT is very good. I recall I think more than 15 years ago I had a soldier. He was working. He was in this 8-man team, and he went to the enemy territory, and then one of his buddies, one of his soldiers, were killed by a sniper. And they brought the body, but they couldn't bring it to the camp. So halfway, he was given an order to bury the body. And when he buried the body, he could feel the body warm. And later he felt that he buried his friend alive. And after a few weeks' time, he had acute symptoms of PTSD, severe survivor guilt. So we used rational emotive therapy and CBT to treat him. I would be glad if you can translate this story to the audience in Russian.
Which part of the story?
About the survivor guilt, the soldier with survivor guilt, and how he was treated with CBT. Modality, and you can just explain about the EMDR.
Добре, отож, доктор Руван попросив перекласти частину з того, що він розказував про свій досвід роботи із пацієнтом, який мав так звану вину людини, яка вижила. Тому що ми знаємо, що дуже часто люди, які вижили після травматичних подій, можуть відчувати такий комплекс переживань. І в нього були міркування з приводу того, що коли він ховав одного зі своїх побратимів, то відбулось поховання, поки людина ще була жива. І доктор Руван розповідав, власне, про те, що Якщо порівнювати ефективність когнітивно-поведінкової терапії та такого напрямку терапії, як EMDR, то EMDR, де використовуються, наприклад, рухи очей, є більш ефективною.
Okay, thank you very much. And also, you ask about the art therapy. Actually, art therapy is very effective, especially with children, those who have nightmares. Art therapy effective because sometimes children can't use. They are not articulate. They can't use language to explain their traumatic feelings. So art therapy is useful using for children and even with adults. Sometimes I use art therapy because those who have nightmares and flashbacks.
Mm-hmm. Thank you. And maybe one more question. I'm really
Sure, please. Yeah.
How many sessions does it usually takes in your treatment, and what was your longest experience of work with a post-traumatic patient?
Oh, it's a very interesting question, and kindly send me your email to me through Natalia Viktorovna. I will send you my PDF version of Shell Shock to Palali syndrome book. It describes a lot of case studies. Actually, I do 10 sessions, sometimes 6 to 10 sessions. If I do 6 sessions, I use antidepressants, fluoxetine, and we used to prescribe clonazepam, but now clonazepam is really addictive. Therefore, we are not giving it for a long time, maximum 7 or 10 days. With drug therapy with EMDR, very effective, and you can eliminate a lot of PTSD symptoms. And sometimes I do 10 treatment sessions. My longest period, I have worked with some patients years and years, maybe 4 years, 5 years, with that soldier with the POW, that prisoner of war. I worked nearly 4 years with him. And we couldn't eliminate most of the symptoms, but at least we could prevent suicide, samaubistva in him. So I think that was one of the successes that we achieved. And also in Canada, I treat a lot of people with drug addiction. Because I treat hardcore people, like, there are these crystal meth, ice, heroin, amphetamine, and severe addictions I treat. So people with addictions, they need long years of psychotherapy, CBT, EMDR, and I have patients like 3-4 years of treatment. Sometimes the patients, they need patients with personality disorders, especially borderline personality disorder. They need long years of treatment. Sometimes they depend on the therapies, which is not good, but sometimes you can't help that. They need that emotional support because they don't have families, they don't have friends, they don't have relations. So the dependence of therapist is huge. So it takes long years for you to treat that type of patients.
Mm-hmm. Fully agree with you.
Yeah, please translate the key essences of what I said.
Окей, так. Трошки перекладу. Власне, я запитувала про те, яка середня тривалість роботи доктора Рувана з посттравматичними пацієнтами, і яка найбільша тривалість роботи з його досвідом. І він розповідав про те, що середня тривалість роботи становить 10 сесій. Але якщо психотерапія поєднується із медикаментозним лікуванням, то це може бути навіть і менше, може бути 6 зустрічей. Стосовно його найдовшого випадку роботи, це було приблизно 4 роки. І впродовж цих 4 років не вдалося повністю нівелювати симптоми ПТСР, але вдалося попередити суїцидальний ризик, тому доктор Руван вважає цю роботу ефективною. Також зараз в Канаді він дуже часто працює з людьми, які додатково мають проблему залежності. І це теж дуже довга робота, так само і в тих випадках, коли мова йде про розлади особистості. Тому що ми знаємо, що розлади особистості – це така патологія, яка вимагає не менше, ніж декількох роботи або навіть постійного психотерапевтичного супроводу. Сподіваюсь, я вірно переклала основний зміст.
No, no, you did an excellent job. Still, I can understand Ukrainian, but I speak very few words like Probachty, Budlaska, Dyaku. Okay, any other questions? You can ask in Russian.
Hello, sir.
Yes.
Good evening, sir. My name is Anurag Krishna. I am in second course of Vinnytsia National Medical University, and I'm very glad to see you, sir. I have read your article before, and first of all, I would like to thank the university administration for giving us chance to join these kind of conferences and seminar in this COVID situation. Sir, your presentation was phenomenal. I have 3 questions, sir, if you don't mind.
Sure.
Yeah. Sir, there is a phase in any kind of cure. There is a phase when we are dealing with a psychiatrist, there is a phase of denial. Is there any case or how to deal with the situation when a person or a post-traumatic in a person having post-traumatic stress disorder, when they denies that I don't have these kind of issues, how to deal with that kind of patient at that particular moment?
Yes, some patients are very, very defensive and they deny and they don't want to highlight that they have this PTSD condition because one thing is stigma associated with psychological and psychiatric illnesses, even though PTSD not a psychiatric condition, it's a more psychological. I can answer you with one of my case studies. I remember one time I treated a high-ranking military officer. He was a full colonel in the Sri Lanka Army. He had a PTSD attack, and he was brought to us, and he was against because my treatment center was in the psychiatric unit. My PTSD center was so he felt humiliated being treated in the psychiatric center. And he was in a denial, severe denial. He said, no, you are wrong, and said, I don't have a PTSD type of reaction. And when he was talking about his trauma, he said about a lot of military operations that he underwent. And once he said, when I was in that operation, I saw one general. That general had been dead for 5 years. So then I thought this was a flashback. So I knew that time this officer was having acute PTSD, even though he was in a denial. Then he refused medication and he went back. And after 6 months, they brought him in chains. I mean, he was, because he went into acute PTSD flashback. He started hitting his colleagues and fired all over. So they had to restrain him and bring him back to my center. So at that time he realized, then his ego was flat. Then he realized
kind of lowered down.
And sometimes the relatives also deny, especially with regard to children. They don't want to use the term PTSD. So as future doctors, when you are treating trauma-related patients, I think it's better not to use the term PTSD at first sight. Gradually, you can discuss about the symptoms, and of course, denial will be there in any, especially with psychiatric illnesses. I have seen when I was doing psychiatry, with schizophrenia or bipolar affective disorder, acute transient psychotic disorder, psychotic depression, even with depression, people come with denial. Denial is, I think, very universal thing. And it was a good question.
Okay.
And if someone can translate the key essences of what I said, I would be glad.
But Dr. Ruvan, maybe it makes no sense to translate because majority of people here, they speak English.
Oh wow! Yeah, that's what because
Yeah.
during our time there are a lot of changes. Actually, I'm very happy. And day before yesterday, I saw a YouTube video, and the beautiful Octavo, beautiful libraries, computer centers, and most of the students I saw this bibliotheca with English textbooks. Actually, the students. You are very lucky. During our time, we didn't have those facilities. To buy an English book, we had to go to Kyiv. So what we do, we had to go Taina because we couldn't inform the Dekanat. And on a Subotu Voskresenia, we get into literature and go to Kyiv. And there was some bookshops where they used to sell some English books. So you buy a few English books. It's Ochin Redka. Sometimes these books are not available. So you buy some English books and come back to Viditsa the following day. But I saw that library filled with a lot of English books. So you are very lucky. And I remember if Vladimir Yasoslavich is here, Professor Iftarak, he could recall. I was not very good in operativne chirurgia because I couldn't study operations by reading a book. So that was my problem. And but eventually I gave the exam with the Troika. So it was a festival for me. But later on, when I watched these YouTube videos, how to do these operations in Shitavidne Zheleza and how to do this appendicitis and other operations, I used to think nowadays students are very, very lucky because by watching that video, you understand. So our problem was when I was in the third year, because you learn in different ways. Because by reading, I couldn't get that concept of how to do the operation. So in that type of Pridmeti, I was not good, but I was good in psychiatry and neurology. So that's what that time I realized that I should follow these footsteps. But when I first started working, I got an appointment as a senior house officer, Jinanovs. So Jinanovs was Sloshnia. Actually speaking, during our time, we didn't have the opportunity as students. We didn't have opportunity of doing cesarean sections at the university. Only whatever very rarely we had to. We got the opportunity of taking part in operations. That's also just to Dershad Zerkala. So, but when I came back to Sri Lanka, I had to do the operations. So there was no word. If you say you are a doctor, yes, you are a doctor. So go to the theater and start doing this operation. And so I was confronted with these challenges, but we got very good knowledge from Vinitsa Medicinsky Institute. Actually, now the university, we had brilliant teachers, and every time they motivated us. And I was telling you frankly, up to the third year, I was not a very good student. Because I was not a serious student. After third year, I started becoming a serious student. And I remember one time our teacher in anatomy called me a tourist. Ruan, for Ruan they call me Ivan. Ivan, почему ты приехал сюда? So, the tourist? So after third year, I started studying seriously. And so when I was doing Gyn Obs, I did 723 cesarean sections and not a single maternal death, not a single complication. I did Gyn Obs for 2 years. So after that, I thought, this is it. I don't want to do Gyn Obs anymore because you can't, every time you have to do duty and no time to sleep. So I decided to leave. But the time when I left, the hospital director pleaded me. He said, you are a brilliant doctor. Why don't you stay with us? And we need you. But I said, no, sir, I need to leave because I want to follow psychology as my career. And he gave me a letter that because my predecessor, who was from the on Miestne branch, like on Uchilsa Miestne Medicinska institute, there were 2 maternal deaths. So when I first went, they had this idea with a Russian graduate, but later I showed them that Russian graduate was excellent. And they gave me a letter, and I still have that letter. And recently I sent the copy of that letter to my professor, Anatoly Nikiforovich Gastruk, Professor Gastruk, because Professor's son is on my Facebook, Sergey. So, and I had the opportunity of talking to Professor Gastruk, and he was very happy. So when you go back to your own countries, you will have these, minor discriminations, but don't pay attention to that. The most important thing is follow the knowledge, not the ascenki. That's what I learned. Because recently I spoke to one of my colleagues, Sergey. He's from Tulchin, and he was an atlichnik. And I said, Sergey, we помним, как я работал во время в институте. Я не был серьезным студентом, но он мне сказал, да, правда, но you learn the предмет, not for ocenki. So I think because when you start working as doctors, there will be a lot of challenges, and
yes, absolutely.
Yeah, and there's no one to defend you, and nikto ni apprav that. So you have to some severe. You have to be cautious and face it. So when you start working in your own places, nobody's going to see whether you are atlichnik or you have Krasny diplom. If you can't do a simple operation, if you can't do a ligation, if you can't do a tracheostomy, if you can't do a simple operations, that's it's gonna reflect in a bad way. So prepare for that, and I would advise the new students to do a lot of prakticheske naviki, go to the hospitals and see how speak to the surgeons and physicians, ask how they treat patients, and because in Sri Lanka, generally they think the Soviet trend, actually those Soviet graduates, and they have very good dentology. They are very good with patients. They are very, they listen to the patient. They have very good bedside manners, because we were taught in the institute. In the first year was dentology, the bedside manners and how to abrati the patient. So those are very, very important things that we learned. And in other institutes, the other places, some of the doctors, they didn't have this training. So some people, they didn't want to listen to their patients. Just 2-3 lines, they started writing the Nikasva. So actually the Russian trained doctors, especially the Yeah, our students from Vinitsa Medical Institute, they are in top ranks. In each predmet, they are heading. And if you say surgery, we have Keith Chapman. He's a very good surgeon from Vinitsa Medicinski Institute. He's in England. For physicians, we have Victor Mendes. He's in UK working as a physician. And anesthesiology, Nilmini Vijaysurya from Vinitsa Medical Faculty. She's a very good consultant anesthetist. And Sudebne Medicina, we have Ajit Tennakon. He's an excellent judicial medical officer. And a lot of people. And people like New Zealand, Australia, and everywhere. So Vinitsky Medicinski Institute, сейчас теперь Vinitsky Medicinski University, это очень сильный institute, and I am so privileged to study there. And I remember my time, some students were trying to go to Moscow and study, but I think I remained in Vinitsa because I knew that the Vinitsa would give me a good training.
Yes, sir. I think those old times still have a bit of sand prints, but our university is really approaching to a apex and a good level on the practical skills also, as I'm gathering the information from our seniors and Ukrainian students too. So my next question, sir. So what should be the threshold? Hello, sir.
Excuse me, before you ask the question, I just can't live without saying goodbye to everyone. So I'm having a consult, which means I have to leave. I'm very grateful for this lecture.
Okay,
And,
thank you so much. So
I'm looking
please,
forward to interact with you. You're
yeah,
so
sure.
very
Yeah, please
motivational.
contact Natalia Viktorovna. She got my email, and please write to us. And I will send you the copy of my Share Shock to Paladi Citram PDF
Thank you.
copy.
Thank you.
Thank you very much.
Goodbye.
Goodbye. Yeah, please go ahead with your question. Yeah, you asked about threshold.
Yes, sir. Sir, my question was, what should be the threshold of getting? Can you hear me, sir, properly, please?
Yeah, I can hear you. Yeah, I understand your question. So you want to know the threshold of getting PTSD, the magnitude of trauma. Am I correct?
Yes. Yes.
I would say each person has different threshold. I have seen combatants who've been into the war. They have seen artillery fire like rain, but they were not shattered. They go inside a tank and having their dinner. And I have seen some soldiers with the first attack, first baptism of fire, first artillery attack, they go into full combat, full-blown symptoms of PTSD. It's the psychological threshold like your immunity. It's like your immune system. Sometimes you are hit by some bacteria and viruses, you won't get the illness because your immune system is strong. So some people, their psychological immune system is very strong. It can be your genetics. It can be your psychological interpretation. For instance, in North America, I see a lot of people with sexual trauma, any type of harassment, any type of mishappening, and they interpret as sexual trauma, and they have PTSD. But in other cultures, I have seen even major sexual trauma is not causing PTSD because of the social interpretation. And the other thing is the childhood trauma, especially people who have childhood trauma. When I talk about childhood trauma, the maternal or paternal deprivation, death of mother or father when they were small, when they were when they were 6 years old, 7 years or 10 years old, it's gonna affect them. and any childhood traumas, any sexual abuse, any negligence, and if the child has been exposed to any fatal illness and long time he was treated at the hospital, so that fear. So those things are very, very accountable. And so there's a psychological immunity in each person. And sometimes they don't get PTSD then and there. Sometimes people encounter automobile accidents or any traumatic event, but the first 6 months they are okay. The first 2-3 years they are okay. After 5 years time, maybe 10 years time, when they face some problem, death of a spouse or any financial calamity, then their psychological immunity goes down. Then they can have the former attack PTSD. Actually, a lot of World War II veterans in their 90s now are getting PTSD attacks. So we have to be very, very cautious about these Afghansky veterans and Chechnya veterans. And so when they grow old, they can come with PTSD reactions in the forthcoming years. Be prepared for that.
Okay. Sir, self-help is also very important for overpowering or overcoming this situation of PTSD for an individual also. So how an individual can make their emotions refurbished after going through these kind of situations, sir?
Yeah, because trauma is an unavoidable psychological trauma, catastrophes, natural disasters, terrorist attacks, everywhere. It's like viruses and bacteria around us. We can't escape from those things. So you can tune yourself. The best thing is to psychologically ukripliat yourself. How can you do that? So breathing meditation is very powerful. And if you try to live in the present moment, because 99% of my PTSD patients, they don't live in the moment. Either they live in the past or they live in the future. If you can focus your mental state to focus in the present moment, and it becomes a habit, then even though you are shattered by traumatic events, you have that psychological immunity of facing the trauma. And the other thing is existential way of looking at things, even a death, any loss. Because this social interpretation is very important. As I said, in some cultures, sexual trauma is a major stigma. It's a stigma for the family, not for only for the victim, for the family, and it can ruin. It's harder than a death. Yeah. So in that type of social conditions, so they have preset of beliefs about trauma and its interpretation. So those psychological interpretations also important, because that's how you're going to define the psychological trauma, because the culture is very important in understanding PTSD, and also culture is very important healer. The cultural factors also we have to take into consideration, because in Canada, a lot of Russian patients are coming to me because I understand their culture, even though I'm not very fluent in Russian now, but I understand their culture. I understand people who speak Ukrainian, people who speak Russian, even those who speak Georgian and Azerbaijani also, they come to me because I have that Eastern European understanding of the culture. So sometimes the therapist may not understand the culture. Is very difficult. It's like there's a huge barrier. It's between you and the patient.
Okay. Dr. Roman, thank you very much. Question from your teacher, Professor Mikhail Vladimirovich Елтуховский.
Очень рада, профессор.
Доктор Роман, рад вас видеть. Вы меня помните как ассистента.
Я вас помню.
Я помню вашу группу. У вас было в основном ребята, девочек не было почти. Это была одна из самых таких сильных групп, которые очень хорошо учились. И вы знаете, вы столько радости сегодня обеспечили сотрудникам нашего университета, потому что для учителя, ну, лучшей благодарности, чем такие успехи ученика, нет. И вот Сергей Владимирович подтвердит, что это действительно для нас прекрасный день вы создали, потому что вы успешный человек, вы признаны во многих странах были, это вы показали сегодня, это очень прекрасно. Я думаю, что Сергей Владимирович будет иметь запись этой встречи, и он будет показывать нашим студентам, это очень важный материал. Я искренне рад вашим успехам и желаю вам дальнейших успехов в жизни, всего-всего вам наилучшего. Человеческого счастья, успехов в профессии, приносить радость другим людям и учителям в том числе. Благодарю вас.
Спасибо вам большое, профессор, потому что вы были прекрасным преподавателем в третьем курсе. Я помню, это было в 87-м или 8-м году. Я помню, один раз я вам задал вопрос. Я вас спросил, потому что у меня был такой вопрос. Когда будущие люди, они будут, у них будет искусственная еда, они будут таблетки принимать. А вы мне сказали, нет, как вот будущее, они будут принимать натуральные продукты. И вы были правы, потому что сейчас в Южной Америке люди идут к органическим фуд. И я помню вот этот разговор, и физиология вы нам читали. Это было прекрасное время. Спасибо вам.
Спасибо
Благодарю за знания, вы сдавали, и преподаватели, как вы, и профессор Серкова, профессор Веская и так далее. И нам давали очень хороший фундамент. Вот за этим мы могли идти вперед. И мы очень благодарны для этого. Спасибо вам еще раз.
Спасибо вам тоже большое за хороший день, за хорошие слова. За ваш успех вам тоже спасибо от нас. Спасибо большое.
Хорошо, спасибо. Еще я хочу, I would like to extend my thanks to the Dekanat of Pivnitsa Medical University and Prorector, and for giving me this opportunity. Thank you very much, sir.
One question, Dr. Priyanka, please, your question.
Good evening, sir.
Badly in Moscow.
Can you speak a little louder?
Yes, sir. Can you hear me now?
Yeah, please go ahead.
Good evening, sir. I am Priyanka Shah. I am from second course, Benicia National Medical College. And my question to you is, what is the fine line between PTSD and being illusioned? With an example, I would like to say that an year back, when I went to consult an orthopedic doctor, then there I saw that a patient was coming out with his family member, and they were quite disappointed with the doctor because according to the doctor, the patient was describing things which was all in his head and was not happening in reality. Do you think that sometimes patients can really make up things, or they entangle in their own thoughts?
Yes, Priyanka. Because whatever the predicament you study, you can be a good surgeon, you can be a good physician, neurologist, but you should have this knowledge of psychiatry and psychology, because patients, they can come with not delusional, sometimes strongly held beliefs. And it may be not real. It sometimes overvalued ideas. So you have to respect that. I think the problem with that orthopedic surgeon or that doctor, he forgot this factor, because patient can come with make-up stories Some deliberately make up stories in borderline personality disorder. Sometimes they can accuse the doctors even. They are therapists they can accuse. But some have certain delusions, but they are not psychotic. They can come with certain expressions which are not real, but for them it's real. And if you point blank challenge them, you are challenging their ego. Then it affects your therapeutic relationship. I actually now I'm treating a patient from the United States. He has come to Canada seeking protection. He thinks that the CIA is monitoring him, planting all these miniature electronics in his body. For a general physician or a doctor, he may be a schizophrenic or he's having a delusion, but not. I mean, I spoke to this person. He's very rational. He comes with. I don't see any. Psychotic condition in him, but he has medically unexplainable symptoms. And there's a condition called medically unexplainable symptoms, and he attributes it to the CIA. So he had a lot of problems with a lot of doctors, but he likes me because I don't challenge it, but I'm using cognitive mode for him to re-realize the errors in his thinking. In our last meeting, I asked, I mean, what is the rationale of the CIA to pursue just a general person like you? I mean, what do they gain? So he thinks, I mean, eventually they want to kill me. Okay, what do they gain by killing you? Do they gain $1 million, or do they gain some secrets, or do they gain something? Then he was speechless. Then he realized. So those are the techniques, Priyanka, we have to use, especially treating with those patients. So in your future practice, remember to listen to the patient. I remember during our time, our professors often said, Slava, Rastenia, и Hirugicheski tools. So Slava, it's very important because Freud treated his patients with words. And sometimes these antidepressants are not very effective because in the North America, I see the doctors for any minor depression situation, the doctors start treating people with SSRIs, antidepressants. And here you find a lot of people, they've been using antidepressants for 20 years, 30 years, but still they are depressed. So how do you explain that? And any trauma-based behavior in a child, they say ADHD and start Ritalin. So those are the negative things I saw in Canada, in America, treating. Whereas in the former Soviet Union and in Ukraine, when we were studying, actually we were trained to use words with the patient first. And I remember there was a placard in the institute that time. So Haroshe Vrach, he can heal the patient with words, which is true. Sometimes within few words, you can heal the entire calamity in the patient. So in your question, of course, yes, patients can have certain delusions, overvalued ideas, medically unexplainable symptoms they attribute to various things, but they are not rational compared to others, but for them they are rational. So we can't say those people are having schizophrenia or delusional disorder, but there's something beyond that. So the best thing is to have a good therapeutic relationship in that case. Did I answer your question, Priyanka?
Priyanka, you are muted.
Sir, can you hear me now?
Yeah, I can hear.
Sir, one more question for you.
Yeah, sure.
I wanted to ask what inspired you to work with such persons who might be a criminal, a murderer. Aren't you afraid of them? Doesn't this thing come into your mind that I'm working with such persons? What inspires you the most?
Yes. I had some experiences. Yes, one time I was working with special forces soldiers in Philadelphia, Coatesville, VA, and I was given a special soldier with PTSD, and he was a huge guy. And the other thing is, while during the therapeutic session, he went into a PTSD flashback, and he could attack me, but he didn't because he's trained to kill people like nothing, like bare hands. He could kill me like a chicken. So those aggressive moments are there, but there was a nurse who was monitoring the patient, and immediately she came. And in Canada, once I had an experience, once I went to take the psychological assessment of a patient, and he had drug-related psychosis, and all of a sudden he got up and he came towards me in a very aggressive way. At that time, I got frightened actually, and I was backing off. And there was a nurse. Actually, she's from India. A very small-made nurse, and she was pregnant too. She came out and said, "Please go back to your room." And the patient went, and I realized that the small-made nurse's command was powerful to the patient. So those are professional hazards. Those are there. And once I had a patient who has killed 130 people, a serial killer. And one time I parked my vehicle near the ward, and one patient damaged my vehicle. So those professional hazards are there. So you have to be cautious of that. But most of the time, I don't believe psychiatric patients are aggressive. Actually, most of the violence were committed by not psychiatric patients, sane people like you and me. So we can't label the psychiatric patients are aggressive. Of course, aggression is there when they have hallucinations or flashbacks. Yeah, we have to take precautions. Always, when you enter, always be cautious about an escape route. In case of emergency, we have to run. And also alert your colleagues so they know where you are. And in our setup, we have a code word. If a patient gets aggressive, we call nurses station, and we say we need the purple file. So that's so rather than shouting, "Oh, this guy is going to attack me," we say, "I need the purple file," so they know that it's an emergency. So then they come to rescue. So yes, when you are working with in any medical profession, hazards are there. If you are a surgeon, if you are operating a HIV positive, Hep C positive patient, there's a risk of contamination. If you are working with corona infected patients, of course, there's a risk of getting corona from the patient. So any other profession, if you are treating tuberculosis patients, you are exposed to TB. So as in psychiatry and psychology, the risk is there. So those are called professional hazards. So we need to take precautions and be aware of that. But I'm telling you, you don't need to have any fear. Like, and if you have a good rapport with psychiatric patients, they trust you. Even though they are delusional, they have even patients with schizophrenia. Very hardly they attack the doctor because they know they have some inner feeling. This person is helping me. This person is treating me. So if you have the positive therapeutic approach, you can always handle. You see these the large elephants are handled by tiny mahouts. So it's not always through aggression. It's true. There's a certain human communication. There's a body chemistry, eye contact, the way you approach the patient. Those things actually it's gonna take into account.
Thank you, sir.
Thank you very much.
Thank you very much.
Do you have any
Do you
questions?
have any questions?
No, sir. It was really a great pleasure to be a part of the session. Thank you so much.
Are there any more
Are
questions?
there any more questions?
No, sir. Thank you so much.
Okay, Priyanka, you're most welcome.
You're most welcome.
Please, Dr. Manu, question. Your question, Dr. Manu.
Thank you so much, sir. Am I audible? Yeah,
Yeah,
so
yeah,
I'm Manu
can hear you.
Srivastava, and I'm a second year med student at Vinitz. And it's my heartfelt gratitude to you and to the Dean and Pro-Rector, sir. So my question is how this stress disorder can affect the patient like to return to his work, like how adversely it affects.
Yes. For instance, recently I had an Uber driver. He met with an automobile accident with acute PTSD. So imagine his condition now. He has fear. Being in the car to driving the highway, he has fear. So he couldn't continue his profession. And one time I treated one nurse. This was maybe 15 years ago. While she was giving a bed bath to a patient aspirated and died. That was a traumatic event for her, and she couldn't work as a nurse. And soldiers, mainly, who were shattered by combat trauma, they don't like to go back to the battlefield. I remember one soldier who was exposed to landmine, but he escaped with minor physical injuries. When he sees double cabs, he gets fear. He doesn't get into a double cab. So those are things that definitely gonna impact your profession. But in North America, sometimes people overuse the term PTSD. Sometimes they want to get certain health benefits, financial benefits, and they tend to exaggerate their symptoms. So that part also there. But definitely PTSD is it's going to cause a lot of vocational problems. Sometimes they won't be able to continue their profession. Even we as therapists, we are prone to vicarious trauma because every day we hear their traumatic experiences, stories. So we should use some form of armor, either to have empathy, not sympathy. And the other thing, always do self-care, take vacation, do meditation. And I use a lot of humor because recently, when I spoke to Professor Gastruk, I recall the way he was telling these humorous stories. And one time, we had a professor in Lore. Maybe our old students could remember. I don't remember his email Ochesta. He was Professor Derepa. Professor Derepa, he used to hardly smile. Once I was late for his lecture. I came 5 or 10 minutes late. Then he looked at me and said, "Stobi, karme ashe mat." Then, everybody started laughing. So, there were like those type of humorous things. I still tell to my friends, and humor is a very good instrument, breaking trauma, boredom, and stress. So I really allow to recall some of the humor we heard from our teachers and from our students. So those are the things you have to take as preventive measures.
Yes.
Thank
And
you
so
very
one
much,
more question.
everyone. We are glad that you agree presentation your lecture, and you promise and you present you and your history in our university. And now time lecture finish, and you must some rest have. Thank you very much. Thank you, teacher. Thank you, student who will come to our short meeting. It's the first step to our cooperation. Thank you very much.
Спасибо вам, дорогой доктор Ланджая Тунге. Спасибо. Мы вашей лекции открываем цикл последующих лекций наших выдающихся выпускников. Мы будем приглашать тех выпускников, которые работают успешно за границей, и будем показывать студентам и преподавателям этот успех. И если вы разрешите, мы эту лекцию записали и поместим на сайт университета для того, чтобы можно было ознакомиться с содержанием, если вы не против.
Да, конечно. Please go ahead, sir.
Thank you.
Конечно,
Thank you very much.
И I want to thank the rector, pro-rector, and the office and the students for coming for this lecture and allowing me to do the presentation. And it's a privilege for me. Thank you very much, everybody.
Thank you. And
Thank you so much, sir. Thank you so much, sir.
Thank you so
and
much.
one more thing, if anybody wants to contact me, my email is with Dekanat, Natalia Viktorovna. She has my email. So you can write to me. I can send you the PDF version of my Shell Shock to Palade syndrome book and my PTSD Soviet Union book. That's in English. Okay, being
sir.
said that, so yeah, Sabodin.
Thank you very much.
Okay,
Thank you so
спасибо
much.
вам большое.